If you have a daughter who's entering puberty or who is in the throes of womanhood, this episode is for you. I'm Jill Castle, a pediatric dietitian and host of this show, The Nourished Child. And today I'm speaking with Dr. Melisa Holmes. She's a board-certified OB-GYN, an author, and nationally recognized health educator. She has more than 25 years of experience as an OB-GYN with expertise in pediatric and adolescent gynecology. She is the co-founder of Girlology and co-author of Youology, a puberty guide for every body. Welcome to the show, Melisa.
Thank you so much, Jill. It's a pleasure to be here.
As we were prepping for the show, I shared that I haven't talked about puberty in girls on the show before. And I think it's a great topic for all of us to pay a little bit more attention to because there's a lot going on in this area. One of the things I wanted to start with was just a basic definition of what puberty is, and specifically for girls.
Yeah. So people often think that puberty is just about growing breasts and getting periods, but it is so much more than that. It's actually about a 5 to 7 year time span when hormones guide this very complicated growth and development phase. And for girls, it typically starts with breast buds or hair growth. It's breast buds in about 85% of girls. Hair will start first in about 15%. And then they progress through all the things that we know as moms that happen to our bodies: vaginal discharge, hair growing in new places. There's a big growth spurt. There's also a lot of brain changes going on. And then, everybody, considers the pinnacle of puberty as being starting a period, but it doesn't stop then. There's still a lot of body changes that happen after that first period, the laying on of more fat, which is important, a little more growth, and then finally the brain finishes developing, thank goodness.
Yeah, that can take a while, though, it seems like. What are you seeing in your practice or in the families that you work with, the girls that you work with, that concerns you most about how parents and girls are navigating puberty today?
I think the thing that worries me most is misinformation from girls and their caregivers. And the misinformation spans so many things like normal bodies, behaviors, what's normal and what's not. What about menstrual health? A lot of people understand what a period is, but they don't really understand how the menstrual cycle is important for health, just monitoring your health. And then I think there's a lot of fear-based clickbait that really have parents worried and scared and girls freaking out. So that's the biggest thing that bothers me. But the other thing that bothers me from a more clinical perspective is, seeing earlier maturation in girls who just aren't really prepared emotionally.
Can we talk a little bit about that, early maturation? Tell us a little bit about what you're seeing and actually what's the data telling us?
Yeah, well, we do know that the age of puberty has been changing throughout human history from whenever we've had records of it.
Okay.
And we have pretty good records from Northern Europe and the United States since about the 1850s. The average age of first periods at that time was about 16. And then by the early 1900s, it was 15. And today in the US, it's about 12 and a half. And so we've seen the age of menarche, which is that first period, decreasing. But I think what's more interesting and actually alarming is what's been happening to the start of puberty. So puberty is starting earlier. And the data we have on this really stems from a study that showed us trends in onset of breast development since 1977. At that time, the average age of breast development was about 11. Today, it's 9 to 10. And the trend is that we're seeing about a decrease in 3 months for every decade of the onset of breast development.
Interesting.
And that just parallels all the things that we worry about in society right now, right? Like there's increased obesity, and we know that body fat is an organ that releases insulin and releases growth factors and leptin, which is critical in pubertal development. We know that kids are getting less nutrient-dense foods. We have more endocrine disruptors, which are concerning. And that specifically tells us what's interesting about the endocrine disruptors is that explains earlier puberty in thin girls, especially. And so we know that that's a factor too.
Mm-hmm.
And then stress, the new research on ACEs, the adverse childhood events, has shown us that, when there is more stress in a family, puberty onsets earlier. And that's just an adaptive mechanism that we kind of accelerate our reproductive maturity so we can get out of a situation. So from an anthropologic standpoint, it's pretty interesting.
Yeah.
And then decreased activity levels, things like that. So there's a lot that contributes to the earlier onset of puberty. There's no one magic bullet or one thing a parent can do to prevent their child from going through early puberty. But I think that because it's happening earlier, parents really just need to be ready to prepare their kids better in case it does start early. And certainly they will have some friends who are starting early.
Sure. I work with families who are raising children with larger bodies, and of the ones who have girls in the family, this is one of the things that they're navigating with their pediatrician, and they're navigating it emotionally too, because it's complex, right? And maybe you can speak to this, but when you have a 9 or 10-year-old starting their period and showing signs of maturation at that age, emotionally and cognitively, there's some level of disconnect, right? Some level of unpreparedness. And then you have the parent who's trying to navigate that for their child. What are your thoughts around that? And what are some advice maybe that you might have for parents who might be navigating that delicate situation?
It is delicate, but I think if we normalize puberty to begin with, your body is going to go through changes, regardless of what size body you have. Every body goes through changes, and understanding the changes that are going to happen will decrease her anxiety from the get-go. When she starts having hair growing in weird places and it hasn't been explained to her, or when she has, especially vaginal discharge tends to be one of those things that really freaks girls out if they don't know what to expect. So preparing her with just the facts, I think, is really protective for their emotional health. But I also know, we know from the research also that, girls especially who go through earlier puberty, they have a poorer body image. They are sexualized earlier. They risk, being taunted by their peers, and they actually have riskier peer associations. So we have to also just talk openly with them about boundaries and about bullying and all of those things that we worry about so much as parents, but especially with this younger set.
Explain the risky social interactions.
Right. So when a girl's body looks more mature than her mind is and her chronologic age, she is seen as more mature. This is especially more prominent in Black girls. It's called, this early adultification of Black girls. Mm-hmm. And so people assume that they have greater sexual knowledge, greater sexual interests, and they're at risk for either being victimized or just even being taunted.
Mm-hmm. So how could parents, do parents prepare their children for that? Or is that something a parent just sort of monitors for and watches out for?
I don't think parents are going to see it if it's happening at school. Mm-hmm. I think those are the things that happen, and then suddenly it comes out one day and it's been going on for months or weeks or something. So I'm a big believer in helping kids understand their bodies and sex from a young age and what's appropriate, because we know that children who understand sex and the proper context for it are less likely to be victimized. Sexual predators do not go after kids who know that sex is for grown-ups and that these body parts are mine and you're not supposed to touch them, and that there are no secrets that should be held between adults and children. So there's this education about sex that's not really, let's talk about foreplay and orgasm and all that. It's really, what is sex? What is it for? Who is it for? And, understanding your body and your boundaries.
Yeah, that's good. What do you think some of the biggest mistakes well-meaning adults make? And I don't want to just say parents, because I know we're talking to parents, but I'm also thinking about the gym teacher and the coach and adults in young children's lives. What sort of well-meaning mistakes are happening to young girls who are, embarking on this major change?
I think anytime adults are talking about other people's bodies, what they look like, how they're moving, things like that, it just needs to stop, because then that girl thinks, well, what are you saying about my body? And then she becomes more conscientious about her body and what people are saying about it. And it's even moms, and we do our best, and none of us are perfect, and most of us grew up in households where we did not have a mother who felt great about her body. That's just been a generational challenge we have all had, and we all try to get a little better. But especially moms and other influential women in girls' lives talking about their own bodies and criticizing their own bodies, I think that is one of the biggest mistakes we can make around growing girls.
Hey, quick pause. If you've been feeling worried about your child's health, their eating habits, or even their body image, especially if they're growing up in a larger body, I see you. A lot of parents I work with are noticing things like overeating, sneaking food, or a drop in confidence, and they don't want to put their child on a diet, but they do want to help. And that's exactly what I teach inside my group program, Raise a Child Who Thrives. We work on the habits that actually matter. Your home environment, feeding dynamics, food balance, sleep, movement, all through a whole child approach. No dieting, no shame, just practical strategies that work. If you want to get on the wait list for the next group, head to thenourishedchild.com/waitlist. Okay, back to the show. It's funny, we were talking earlier, you have 3 daughters, I have 3 daughters, and I always get this feedback after these shows from my daughters, like, you said this, but I do feel like I was really good, and probably I'm a medical person too, really good about naming the parts, the names of the parts. Like,
right.
Really sort of being upfront with the names. And that was sort of revolutionary at the time. And this is the 90s, right? Mid 90s. Where are parents with that sort of conversation today? Are they more comfortable having this conversation, more comfortable saying, all the genitalia words? Where are we at in 2026?
I think in 2026, parents are better. And I think that for all the faults that social media has, I think it has made us more comfortable seeing things that we didn't look at before, talking about things we didn't talk about before. So I do think people are better about naming body parts. They still call everything down there a vagina, and I wish that would stop. It's a vulva.
Yeah.
So that's one of my pet peeves as a gynecologist. So that's one of my personal crusades is I'm so glad you're saying the word vagina, but it's really a vulva and there's a clitoris and labia and the vagina is inside. So, I mean, that's one of the things. But yes, people are getting better about that. What I think they're not getting better about and perhaps getting worse about in 2026 is body image and body talk because of the Ozempic era, because, I live in a college town and a friend of mine runs the student health program. And there are college girls who are not overweight coming in and asking for, a GLP-1, just any kind of diet aid. And there are some who have had it prescribed by their home physician or they've ordered it online and they're coming to the student health center asking for someone to give the injection because they don't want to give their own injection. And these kids, it's getting refused, thankfully. Student health is way better than that. Yeah. But there's just this pressure. Everybody is trying to be thin. And I thought we were getting past that. I thought we were doing better. Yeah. And then here comes all of this again.
Yeah. Yeah. So for those who are listening, what I hear you saying is you believe that the GLP-1 era may be really underlining sort of this continued focus on body image, body image.
On thinness specifically. Yeah, thinness. Right? Yeah. It's easy and this is how we should all look. And, girls will internalize that and think forever that that's how they're supposed to look. When really everybody's body is so different and everybody needs to learn what feels comfortable in their body when they are taking care of themselves.
Absolutely.
And, it's just, so that worries me. That is what worries me the most right now.
Yeah. And I think that sometimes parents and educators and adults in children's lives don't realize that during these years of 9, 10, 11, 12, 13, 14, 15, the brain is really still very concrete in the way it thinks and moving into abstract thought. But when you're a concrete thinker, you really do sort of associate good and bad. So you attribute good and bad to almost everything you come into contact with. Good and bad bodies, good and bad behavior, good and bad food, right? We could go on and on and on. And that's just how the mind of a child thinks. And so a lot of these beliefs about your body get cemented at a really young age.
Yeah.
So when we're talking about girls should know before they start their period? Like, what are some of the essential pieces of information that girls should know, and then therefore parents should be thinking about having conversations about with their girls?
So girls, if they get any kind of puberty education at school, which a lot of them don't anymore, they learn what a period is, and everything about a period is related to either hygiene or reproduction, like pregnancy or hygiene. And that's not what they want to know. They really want to know, what is it going to be like? What's it going to look like? What is it going to feel like? What am I supposed to do when I have problems? And so I think that, we've taught puberty classes for over 20 years. And the questions, even though they've changed a little bit, it's always the same thing. Like, how do I know when I'm going to get my first period? What is it going to feel like? Those are the two most common questions we get from girls.
Or what do I do when it just shows up? I'm at school.
Right. But it's more about where to find a pad. It's about, is this normal? Because that is the height of anxiety for young people, is not knowing what to expect, right? That's a definition of anxiety, worry about the future. And so if she doesn't know what to expect, that creates anxiety. If she doesn't know that her menstrual blood may not look like when she cut her finger, it's got a different color to it. So the color is different. It's not a constant bleeding. And I had one girl who asked me, like, how fast does it shoot out? I mean, like, it doesn't shoot out, it trickles, So we have to kind of get a little more realistic and concrete with them about exactly what to expect. I think that's what they should know. Now, certainly they should know, where do they go for help if they start their period? What do they do? The other thing I think it's important to know is that we should not normalize pain. We should be curious about their pain and figure out if we can manage it with simple measures, and if not, get them healthcare attention earlier rather than later. We've all been taught to suck it up on our periods, and that's just not healthy. It's why it takes 7 years on average to diagnose endometriosis. It has its start in adolescence. So we want to make sure they understand what's normal and what's not, and when to consult with a healthcare provider.
So if you were talking with a parent about what they should be talking about with their daughter, other than sort of the basics of the execution of the first period, let's say, but perhaps you might want a parent to be also talking about the health associations of having a period. So I find, like, I work with some adolescent athletes also, and that there's such a disconnect between bone health and their period. They have no idea the connection. Right. So what would you want a parent to know from a health lens around starting a period? And you could include nutrition in that as well, if that's something that you talk about with them.
Yeah, I think the key things to know are that, first of all, starting a period anytime between the ages of 9 and 16 is normal. If she has not started her period by the time she turns 16, check with the doctor. There's a long list of things that could be causing that. Most of the time, it's genetic, but there is a long list, athletics being one of them. Then the other thing that I think is really important for kids to know and parents to recognize is that a period is a vital sign. It is a sign of health. And as gynecologists, we've known that, and we've been preaching that for decades. Other specialists are starting to recognize that. When an adolescent girl goes in for a well child checkup, a lot of times she's not even asked about her period. When did you start? How regular is it? All of that. We're trying to get that more normalized now, because we do know that if she stops menstruating, she's got a nutrition deficit. She's got too much exercise. She could have a genetic anomaly. She could have a thyroid disease. So it is a way to diagnose things earlier or prevent long-term consequences related to things like, not optimizing her bone density. So it's a vital sign. And I think if we recognize it as that makes you a little more alert when it's not showing up normally.
Right. Yeah. So I also maybe would like you to touch on the bone health thing, just so parents who are listening can understand the connection of, estrogen and bone mineralization and how that all starts. I mean, we're at, in those first 25 years.
Yeah. Adolescents, they are going through the most rapid growth of bone during the adolescent years, and puberty, actually. which also means that they have the highest need for calories and nutrients of their entire life. I mean, this is when they need it the most. They particularly need calcium and vitamin D as they're laying down bone density. But we also have to look at iron. We have to look at protein. And for athletes, there's even more nutritional needs that we need to assess to make sure they're getting enough carbs. I mean, carbs have been seen as bad words or bad nutrients in a lot of arenas, but it's so essential.
Yeah.
So adolescents are laying down bone density really from about the onset of puberty up until about mid-20s to maybe 30, but really up through the mid-20s is essential. And if we're not strengthening our bones through nutrition and exercise, I mean, we need to be weight bearing. Weightlifting is not bad for girls. Strenuous exercise is not bad for girls as long as they are getting the proper nutrients to fuel that activity. So it is critical. And if they don't build that bone in adolescence, then they're set up, women our age are, hitting menopause with osteoporosis and all of that. Now, we've also seen stress fractures in young athletes because of they're not feeding their bones or allowing their bones to strengthen because of that lack of estrogen, which is coming from that regular cycle. That's what's telling us they've got enough estrogen and their calcium and vitamin D.
Yeah. How do you feel about adolescent girls already on, have gone through puberty? They're on a regular cycle, but perhaps they are exercising quite a bit. They lose their period and then they go on the pill.
Yeah. So I posted a blog about Red S last week.
That's funny. My last interview was with an expert in reds.
I love it.
Yeah,
I love it.
We're aligned.
And the funny thing about it is when I was doing carpool with one of my daughters and we were picking up a friend of hers from cross country track, she got in the car and my daughter's like, I don't know how you like cross country. I hate running that much. And her friend looked at her and she goes, I love it. And I don't get my period during cross country season. It's great. And all the girls were like, oh my gosh, that's so cool. I'm going to run cross country. I'm like, whoa. So when you stop your period during times of intense athletic training or even moderate athletic training, that's a sign that you do not have enough fuel to take care of your body. And your brain will shut down your reproductive system first because it's not as necessary as your heart or other vital organs. And so that's why we consider periods a vital sign. It is one of those red flags that your body will say, hey, I'm not getting enough nutrition. Feed me. And that's when it really is important to consult with a dietitian, a gynecologist, whatever. Now, a lot of people will say, oh, you're not having your period. Let's put you on the pill to supplement that estrogen. That just masks the symptoms. And if the girl needs birth control, then absolutely put her on the pill. I'd rather her not get pregnant. And we can work on the other side to look at her weight and her performance and how she's sleeping and things like that, which are all impacted as well. So, the pill isn't dangerous or hazardous, but it does mask problems related to amenorrhea from overexercising or underfueling.
Yeah. It's a Band-Aid.
It is a Band-Aid. It is a Band-Aid, but it's very important for contraception if that's needed.
Absolutely. I just want to segue because you mentioned, go to a specialist, and we chatted a little bit about this, but you're an OB-GYN, you specialize in adolescents and young adults. Listeners might not know that that's an option for their daughters. They might not have access to somebody like you. And the idea of going to a gynecologist that delivered you, possibly, or going to your pediatrician, or for me, going to my primary care doctor for my gynecological care just doesn't sync for me.
Right.
And so can you talk a little bit about the specialty of adolescent and young adult gynecology?
So there are lots of OB-GYNs who love taking care of adolescents and are skilled at it, and they don't have to have specialty training. There are lots of OB-GYNs who are horrible with adolescents. And so it's important to get a recommendation. Now, there are some specialized OB-GYNs called pediatric and adolescent gynecologists who can do gynecologic care from birth through young adulthood. And actually, most of them can do it through all of adulthood, but they choose to focus on the younger people. It is a fellowship training that that OB-GYNs can do. Actually, adolescent medicine doctors can do it too. So they're not just OB-GYNs. It's one of these cross specialty subspecialties, if you will. So we have some pediatricians who have done the training, some adolescent medicine, but to do the fellowship, you do have to be an OB-GYN. They have a better understanding of development, of puberty, of reproductive health for adolescents, of contraception for medically complicated adolescents, which is a big part of what we do, and really just all reproductive care for that age group. And they love teenagers typically. So that's a big part of it. And it's always nice to go to someone like that. They typically have longer appointments. Yeah. And I will also say that if you take your child to an OB-GYN or a peds and adolescent specialist, it doesn't necessarily mean they're going to get a pelvic exam. And that was always a big fear that parents had. A lot of times our visits are just talking. Sometimes it's just doing an external exam, and sometimes it's just kind of managing medical conditions with menstrual health. So it's kind of a broad range.
Yeah, no, it's so great to know that it's out there, because I would assume, and correct me if I'm wrong, but with the earlier onset of puberty and menses, you might be seeing other complications or long-term medical problems. I'm thinking PCOS. I had somebody on the show a couple of years ago who spoke about PCOS in teens. And, is that something you're also seeing? Some of these,
Absolutely.
Like you mentioned endometriosis, we talked PCOS. Are there other conditions that we're starting to see in younger girls?
Well, PCOS, if someone goes through puberty early, it doesn't mean they're more likely for PCOS. But if they have some other metabolic problems, that does kind of set them up for PCOS. And PCOS can set them up for other metabolic problems like diabetes and heart disease. And so the awareness of PCOS is important. Now, a lot of people think that adolescents having irregular periods is normal. Like, oh, she's a teenager, it's okay, her periods aren't regular yet. There is a pattern that they're supposed to follow. And I think people trained in this recognize it sooner. So just again, one of those medical facts that parents should know is a period should happen at least every 21 to 45 days in adolescence for the first 3 to 4 years. And interestingly, the younger a girl is when she starts her period, the sooner her periods get regular, typically within 2 years. If she's over 13 when she starts her period, it can take 4 to 5 years before she becomes very regular. Despite that, periods should still happen within 21 to 45 days. So if on several occasions she has a period that's more than 45 days apart, and that's from the first day of bleeding to the first day of bleeding in the next cycle, on a couple of occasions, or if she ever has occasion where she goes more than 3 months without a period, that is a risk factor. I mean, that is when we go, okay, we're going to test, we're going to start observing for PCOS. Now, we don't typically make the diagnosis of PCOS in young adolescents, but we do know we need to follow them closely because they may develop it.
Yeah.
Endometriosis is another one that we're very familiar with because in adolescence, I mean, that's when it starts for most people, yet their pain is dismissed and they kind of put it off and it's not diagnosed until they have fertility problems. But in adolescence, I guess our antenna are a little more primed to recognize endometriosis. And then the other condition that I think we see a lot of is PMS versus PMDD, which is premenstrual syndrome, which is very, very common. And that's just, premenstrual mood exacerbations, premenstrual bloating, things like that, versus PMDD, which is premenstrual dysphoric disorder, which is where girls really have some severe mental health challenges in the week or 10 days before their period. And it stops when their period starts. And that's kind of part of the definition. I have seen girls who have been suicidal or completely withdrawn for that time, cannot control their moods at all. And, those are conditions where it's all dependent on ovulatory cycles. And if we can stop ovulation, then we can treat that. And so birth control pills are often used to manage things like that. So those are the conditions that we're seeing a lot of in, young people that I think aren't always considered.
You mentioned earlier in the show that there shouldn't be pain.
Right.
So can you elaborate on that a little bit? And what might that be a sign of?
Menstrual cramps are normal and common. but they should not stop you from doing your normal daily activities. If they do, then they should be you should start treatment with simple measures, heating pad. A little bit of brisk exercise has actually been shown to decrease menstrual cramps, and girls who exercise regularly have cramps less often than girls who don't exercise. So exercise is a big part of it. And then we move to the nonsteroidals. So a lot of people will use the over-the-counter stuff. Honestly, plain old ibuprofen or naproxen are the best, and they've been proven by research to be the best treatments if they're taken according to the package insert. And if her periods are still not controlled with that, please talk to your healthcare provider who has some experience with adolescents. Because that is when we start to think about endometriosis. Historically, that's been a diagnosis we have to make with surgery, but now we can make an official diagnosis based on clinical symptoms. First treatment is stopping ovulation or suppressing menses. And if that takes care of it, that not only is kind of diagnostic, but also it's treatment. And so we don't hesitate to start birth control pills or some other form of hormones. It doesn't have to be birth control that will suppress menstruation to see if they are better. So that's, if we ignore it and we let them continue to have pain and the Midol or the ibuprofen or whatever they can tolerate, or they are on the pill and they're still having cramps and they're missing school, a lot of those girls are going to have endometriosis. In fact, if their pain is not controlled by birth control pills, which is really the best treatment we have that's non-surgical, 50% of those girls will be found to have endometriosis at surgery. So it's significant, and we don't need to ignore their pain.
Interesting. Very interesting. Are there any common myths about puberty and periods that you'd like to take the opportunity to debunk?
My goodness, there are so many myths out there. I think one is that puberty is just about breasts and periods. I mean, we know that's not the case. I think that one that I hear from moms a lot with their concern is that, oh my gosh, my daughter has vaginal discharge. That means her period's coming soon. That's not true. Vaginal discharge is an early sign of puberty because it's in response to estrogen secretion. And if you remember, breast buds are one of the first signs of puberty. Breast buds are because of estrogen. So really, anytime after breasts bud, vaginal discharge is anticipated and normal. The other one that I hear that drives me crazy is when people talk about their raging hormones. So hormones do not rage. They do not rage. They are secreted very, consistently, sometimes pulsatile, and they are doing their job as chemical messengers throughout the body. They're doing what they're supposed to do, and moods are not caused by big hormones. Moods are caused by the things that girls experience and their reaction to those things. And so I want people to stop blaming moods on hormones and periods and really acknowledge that, yes, now hormones can make your moods come faster and feel bigger. So that is true. And that's in boys and girls during adolescence. Their moods come faster, their feelings feel bigger, but their sadness, their anger, it's usually because of something they've experienced. And we need to acknowledge that and pay a little more attention to that.
A question that came in my brain when we were talking was something I had for my own girls was pads or tampons?
Yeah, either. Whatever you like. Whatever you like.
Well, there was always a sort of
the very first period, and it is perfectly safe. By the time you start your period, your vagina is big enough to accommodate a tampon, and tampon size has nothing to do with the vagina size. It is solely for you choose your tampon size based on your flow.
Gotcha. Yeah, that was when my girls started. It was always like, I used tampons, but I felt like for my little girls, I know. It felt like they had to graduate up to a tampon, but I don't know what the thinking is.
Swimmer. I had a friend whose daughter was like a very big swimmer. She had a big meet. She started her period the night before like the citywide meet, and she was seated first or something. And she called me. She's like, "What am I supposed to do?" And I'm like, help her get a tampon in.
Yeah.
And she did, and she did great and all of that. So yeah. Now, culturally, there are some differences in tampon and pad use, and some of that just depends on cultural beliefs and things like that. So we also have to respect.
Sure. Okay, last question. 3 things parents of a girl can do to support them.
3 things that parents of a girl can do to support them. Number 1, I think parents are their daughter's biggest influencers. And so you can practice good self-care, which means eating well, nourishing your body, moving your body for fun, and not complaining about your body. And I mean, I think that was probably 3 things right there, but
Yeah,
that's
that was
one
good.
big one. Secondly, I think you can learn the facts about what's ahead for your daughter and keep talking about it. Like, stay in front of what's coming so that you get to be the informant, because when you are the informant and you're the first one to tell her things, you tell it with your perspective and your family values and all of that. And you're not having to backpedal through other, things or myths that she's heard.
Mm-hmm.
And then third, I would just say, keep it positive, no matter how horrible your puberty may have been. And we all have our stories, right? Like, it's not great, but keep a positive mindset and just practice staying calm, because if you freak out or if you respond with judgment, she's not coming back to you again for when she has questions. So stay calm and keep a positive mindset. And I think that's
wonderful. Wonderful. Do you have resources? I know you, and I want you to tell the audience where they can find your website and your books, but are there other resources, and perhaps they're on your website, for parents to tap into some more of this knowledge, to dive a little deeper?
Yes. Our website, Girlology.com, has a tab that says Dr. Momfidence, and we have an AI agent that goes through only our content. We have over 700 videos on our website. Tips for parents, classes for girls. And Dr. Momfidence accesses our content, which is it's all, physicians, professional experts, psychologists. That's where all the content comes from. And she is amazing. If you ask her a question, she'll give you a better answer than I do. You should have interviewed her today.
That's great. Is that an app, Melisa? Is it an app?
Girlology is in an app. Okay. But Dr. Momfidence is through our website. It's just kind of a little different there. But yeah, that's probably the best way to access us. And we're on Instagram, which is just @Girlology. But I would say just visit our website, and that's probably the best way to find out more about Girlology.
Wonderful. And the book is Youology.
Youology, a puberty guide for everybody. It was published a few years ago. It covers girls' puberty, boys' puberty, and puberty for gender diverse kids. So really, it just helps every kid understand what every other kid is going through. And I think when all kids kind of understand that, they're a little more compassionate towards each other, and they're kinder.
Yeah, great. Wonderful having you on the show. Thank you so much for coming on and sharing your expertise and wisdom. It's great.
Well, thank you so much for having me.
Thanks for listening to the Nourished Child podcast, where the #1 goal is to help you grow a nourished child inside and out.